It's good to be back at AF Williams Clinic. We're doing our road show this month here, and we're excited to be here. We have asked the clinics to sign up to do a road show, and we've already debuted a couple of clinics, Boulder and Lone Tree, and now we are at AF Williams. So if you would like to be a part of this, sign up. Liz has a sign up sheet where you can do this. We come out to your clinic and our executive leadership comes out because we want to get to know who you are. Okay. With that, I'm going to turn it over to Myra and Michael.
Thanks, Lisa.
Thank you. And partly, roadshow is for you to tell the rest of the department who you are. Because they don't all come out to where we are. And we've done some great things about the other two clinics that we've done already. So have to brag about yourselves. So we just wanted to give you a really quick update with what's going on with the strategic plan. And Michael, come over here.
I'm gonna,
Okay. Oh, I
We'll
guess
see
Michael's
here.
gonna work the clickers. He's gonna jump in, but just to tell you where we are. So go ahead and advance. So this is what's happened to date. Next, Lisa. So this is a process that really started back in August, and there was a 2-month period of collecting data. There was focus groups, leadership interviews. You can go to our internet site and click on the tab there and see who all was involved. And then, so that was August and September. Everybody in the department had the opportunity to answer the department-wide survey. And we had a 67% response rate. So, and that was to validate and check out what came out of the focus groups. And that was an amazingly high. Usually the consultant said they get a response rate more in the 30s. So, this really represents what we were thinking, and good uptake there. And then they pulled all that stuff together. And then another thing they did is they went to 3 other departments of family medicine. They're leaders in the field like us, and basically asked them, what are their strategies around various things like serving communities, education, building partnerships. And then they asked them, confidentiality, what do you think about the Department of Family Medicine at the University of Colorado? So we got some external feedback as well. All that got pulled together, and then we had our first strategic planning committee retreat in October. And out of that came the strategic initiatives that I'll show next. We had the first strategy sessions. Okay, how are we gonna achieve these strategic goals? And then just this morning, we had the second strategic planning tactic. And then our final meeting will be in in January, where we'll put together what are the metrics and how are we going to know if we're making progress. And in between today and January, there will be another survey that goes out, not to the whole department, but just to keep validating and checking, are we still on track with what people are saying? So next. Next. So here's the phases. And today we did the second half of strategies and tactics to support our vision and goals. Okay, next. And yep. So here were the strategic planning initiatives that came out of a combination of our focus groups, our steering committee, the leadership interviews across the Anshi's campus, our external benchmarking departments. So patient care, we want to optimize a high quality patient care. You can see each of the ones here. So there was anywhere from 2 to 3 strategic key aims for each of these areas. And one thing that was really stood out for our department is how important our people were. The number one priority was really, we want to have a supportive working environment and supportive work culture for everybody in the department, supportive and inclusive. So you can really see that has 3 aims into it that's different than some of these other ones. So we took all that, and then next, Lisa. Then here were the strategies that came to each of these. And this kind of stuff is going to be on the website, so you can go to it. And also the representatives on the steering committee are also going to be circulating a slide deck for you today, because it's a lot to go through. So the first meeting we did patient care research, today we did training, community engagement, and our people. Okay. Next. So here's the next steps. It said they'll go ahead. That it's an ongoing process, and that's one thing we promised, that whatever plan we come up with would be an outgrowth of all the input that people have given. And there's an ongoing opportunity to give input. If you go to the website, there's a place where you can give your input. You know, you do this, you know, this something, I really support this. So that's kind of ongoing, and we're taking that information in. So we set our vision and goals. I didn't have those, we went over those this morning, so we'll send those back out. And then we're doing the strategies and tactics, and then implementation is where the rubber meets the road. So the next thing we'll be doing in January is picking out of these things, what are the most important things to do first, second, third, because this is really a 5-year plan. And what are we gonna measure to know we're making progress? So part of what will be going out to the members of the steering committee, all right, say you're in charge of patient care or training. What do you want to measure to know if we're making progress on those? So if you have thoughts, give them to your representatives on the steering committee. We'll monitor that. We'll adjust as it goes on. You know, maybe we're on target, maybe we're ahead of schedule, whatever. And then we need to adjust as we go. So this is really a living document. And our pledge to you in the department is we're going to report back at least a couple times a year. Where are we on all this? So this isn't just going to go in a black hole and I'll wonder what happened. And one of the parts about the implementing is selecting who are going to be the people that the department is going to charge with implementing. These are called strategy champions. So that's some of the input. Who can we get to do that? Who's well suited to do that? Who can we support? And then the next part will be assigning the resources to actually help people get stuff done. Okay, next. We'll be voting on what the highest priority strategies are. Again, we won't be able to do everything all at once. But what are we going to try to do first? Where do we need to go out and get additional resources or support from the institution or our partners to accomplish what we want to do? The accountability is the champions. Who's going to be responsible for moving that forward? And then with those implementation champions, then we'll sit down and figure out what kind of resources are needed to get that done. And then that will be linking overall to how we assign our department budgets and other resources overall, so that everything aligns. And then the goal metrics I said, and then keep communicating back to the department. You wanna add anything?
Yeah. Just really quick and by the way, it's just across my year anniversary, so if I haven't met you yet, my name is Michael Cahill. I'm making an assumption not everyone does, so I could be wrong. But you know, what I'm excited to see on this is that line of sight between what we're saying we want to be as a department, how that gets broken out into the 5 big dots, if you will, that a couple slides behind, but what that line of sight is going to be down to from, you know, here's what we say down to the individual, here's what you affect related to what we're trying to become as a department. And being able to, you know, we're going to be intentionally transparent on this. I don't mean that as a buzzword. I mean that as, you know, having the data in front to say, here's what we said was, we're going to measure success. Here's where we are in relation to that. Here's any course corrections. Here's the evolution of the plan based on, you know, what happens internally or externally that affects us. Like Myra said, this isn't going to be something that sits on the shelf or collects dust. So I'm really excited to see what comes of this and to get the ball rolling on it. There's a phrase I like is, if you want to know what's important, check someone's checkbook and their calendar. And that's what this is really going to impact, to say, here's where we're putting our limited number of resources. There's a finite amount of time to address these. So here's the resources we're going to, and people we're going to put to that. And we're going to see it come to fruition. So with that.
So I think our final meeting is in January 24th. The 24th. Okay, and I think that's it. Any questions? Can't believe you guys. are-
Thank you.
Hi, Ruby. I'm just curious, I'd seen some of the prior presentations and the lists, and so all of these make a lot of sense. Is there anything that's particular, and maybe since I've seen it before, but is there anything that's particularly new and different or innovative that's fallen into our main categories? I'm just curious if you have that sense right now. Some of it is just organizing what we already know is important for research. But is there a nuance or a lens to this that is surprising or different for us to understand?
One of the things that comes to mind, it recognizes what might be some unique opportunities for us as a department. And the area I'm thinking about is working with community and community engagement. So as you probably heard about the rural wellness community, we're the lead department standing up the clinic there. It's going to be a multidisciplinary education site. And then the executive, the CEO of the rural wellness community has a primary academic title in family medicine. The Center for Health Equity is being stood up, and that's going to have a lot with community engagement. The inaugural executive director of that new center is also primary title in family medicine. The Chancellor's Office of Diversity, Equity, Inclusion, and Community Engagement, her primary title is in family medicine. And the new director of Accords, who, and Accords does a lot of things related to community, they do lots of stuff, but her primary title will also be in family medicine. So we have the opportunity of having these leaders of important units that are titled in our department. And so that really, puts us in a unique position, I think, to how can we be move forward the community-based, community engaged work, not only of our department, but really of the campus. So, part of it, and the leaders of the campus, they kind of recognize that when they went around and interviewed the dean, the chancellor's office, other chairs, like Shanta and Tom Gronow and Simon from Denver Health, they recognize that and said, you're really in a position to move forward two things that I think we kind of knew, but it kind of focused, and that was around community efforts. And another one is value-based payments. They've really seen us as, primary care and our new innovation practice that Kyle and Amy are and Kalina leading and standing up is another place to really, can we push the needle at a time when the whole sort of healthcare field is kind of moving in that direction. And the campus leadership, institutional leadership, sees us as really having a key leadership role in that. So those are two things I think we've kind of talked about, but to hear, I think for me as a chair, the institutional leaders saying, we recognize that in you. And they recognize our opportunity to partner with other folks on campus. Like the Department of Psychiatry, for example, because of our integrated behavioral health. That's one thing that comes to mind. Addiction medicine is another one related to behavioral health and psychiatry. So those kind of opportunities, it's nice to hear the institution recognizing our potential and where they see us really advancing.
I think it's a really helpful overview, and I'm wondering, with that recognition, will the medical school, the dean's office, will there be additional funding coming to the department, for that as well, so to support this, like just to help the college.
Yeah, and that as a new chair, I got a chair package. And so this is going to help us decide how do we want to invest that chair package. It also helps us decide where, that's not going to cover everything we want to know, everything we want to do. So how do we, the next phase of, say we want to accomplish this one strategic aim, well, we can put in so much, but we're going to need some more support from the dean or from the hospital. And that gives us a basis to go and advocate for that. And then another part of this that I learned from this is we have such an amazing and strong department, and it's a brilliant faculty. And there's a lot of people that had important positions in this institution that aren't aware of that. So one of the things that we realize is we have to do a better and more consistent job of communicating the amazing things we do. And really kind of reminding the institution, our partners, of what's the value that we bring. But the other thing we need to do is we need to really go out and listen and understand what's important to them. What are their strategic initiatives? What are their values? And be able to say, hey, this is how we can help you advance stuff that you're trying to do. We're really good at coming and saying, this is what we want to do and why it's important. But we also need to kind of understand the other side of that. They're going to be much more interested in listening about how we can help them as opposed to how they can help us. So it's just really, how do we get on the same page and align with people? We want to align on everything, but to be listening for that.
The other thing I'll say is, one of the key aspects of this is being able to identify what the priorities are, that versus burning the candle at both ends. It's what's the right work at the right time by the right folks, so that we're not scrounging for resources, but also reallocating, maybe we said yes to everything at one point in life, but what's the right things to say yes to now? And as such, ensuring that while also looking for those areas to grow with both internally and with our partners as well.
I'm really assessing kind of holistically, like, it might be, Alex would be great for this, but he already has 7 other jobs. So are we gonna take off on the jobs? Are we gonna find somebody to give him that job, give him that job? But we're gonna stop doing it.
Are we up against the clock?
Okay, thanks
Other
everybody.
questions, reach out as you need to. Happy to talk to them. So, but otherwise,
And so at this time, I would like to introduce Kathy Siebehard, David Baez, and Mimi Lindrith. They're going to do the presentation for A.F. Williams. So we can find out all the wonderful things they do.
Hello, everyone. Those of you who know me know how much I love presentations. Go meeting, go meeting, go meeting. For those who don't know me or somebody else, my name is Mimi Lindrith. I am the interim medical director while Emily Lyons is on maternity leave. Welcome. We're very glad to showcase and highlight all the wonderful things that happen at AFC. And I thought I would start from the beginning with a quiz. Dr. Connery, you cannot answer. Anyone else, go for it. So who is A.F. Williams named after? Carol, because you're in pink.
And I so shouldn't get to answer this either. God, what was the original phrase? His first name though, A.F. Williams. His face is out front. Arnold Frederick or something?
No.
Adolf.
No.
Albert Frederick Williams. Pictures in our lobby. Go read about him.
Arthur Frederick Williams, who would now be called Dr. Fred, for those of us who know him well. I'm going to tell you a little bit about him. So Dr. Fred was born in Michigan, go blue, in 1881. So he and his family made their way westward when he was 10 years old, set up shop in Fort Morgan, and he went to local medical school, became a general practitioner, as they would call it. Well, he was also a qualified surgeon. I'm not sure what that means. And he also was a pharmacist, and he was a dentist in Fort Worth. So man of many trades. Fun fact, you can go on eBay and buy some original prescriptions that he wrote.
Oh,
Two
so
for
cool.
25. So it's a good stocking stuffer for those of you who are listening.
What happened to get Dan Burke?
So what I read about Dr. Fred was that he was considered pretty gruff and rough around the edges, but very well loved by all patients in Fort Morgan and all of his friends. And I think that is a wonderful way to describe our clinic. Our patients are very loyal, and they love coming here, most of them. But to be honest, you look around, we're a little rough around the edges. And kind of, you go through some exam rooms, some of the blinds are a little cheeky, they're not closed, they don't open. And full disclosure, yesterday or Monday, when we were setting up the room, one of the ceiling tiles fell down. I took one for the team, but I was not hurt. And so Last night I worked evening clinic and I was leaving and the facility guys were in here working and I was very impressed. It's like 7:30. And I was like saying, thank you very much for working late. And they're like, oh, well, we were told there was a big party today, so we haven't finished. So if you get another email asking you to come back to a roadshow, it's only because we want facilities to come back to finish the line. Anyway, so all kidding aside, we are an extremely fortunate clinic because of all the people that are here today. And we want this opportunity to highlight what we do and to, brag about what locations they're in, and what Alex is doing, what everybody else here is doing. We've got folks who are extremely good clinicians, but they also do really innovative projects on the side that many of you may not know about. I didn't know about a lot of them, so along with learning about Dr. Fred, I'm learning about all the great people here. We also host the residents, so we're involved in teaching and training the future leaders in primary care. So we're honored to do that. And so welcome everyone to the roadshow. We hope you find it entertaining and enlightening. But before we go, one more slide. I do want to say thank you to Kathy for putting it together.
You're welcome.
It's a gem. All right, next slide.
Should we play the video?
Oh yeah, play the video. This is our great leader, Emily Lyons.
Yep. Keep going.
Kathy.
I'm Emily Lyons. I am the medical director here at AF Williams. I'm a family physician. I practice in the outpatient setting here at AF Williams as well as in the inpatient setting with our residency program. Welcome to our clinic. Here at AF Williams, we have 54 clinicians. Of those, 20 are residents and 34 are faculty clinicians. Of the faculty clinicians, 4 are APPs. We have a lot of part-time providers because folks have varied academic careers, so on any given day, you'll see 9 to 10 clinicians working with us. We have 25 medical assistants. We have 5 front desk staff, 5 RNs, and of those staff, our medical assistants are trained in PCR, so that just means they can do advanced rooming and help out the clinicians even more. We have 4 behavioral health faculty and 8 trainees. We have 3 faculty pharmacists and then 3 residency pharmacists. We have 2 radiology technicians and offer in-house x-ray. In addition to routine primary care, we offer a few special services here at AF Williams. One thing that we're really proud of is our comprehensive maternal child health care. In addition to our maternity care, we also offer a broad scope of family medicine procedures. So we do colposcopy, vasectomy, in addition to routine skin procedures. We also do a lot of sports medicine procedures with our sports medicine trained faculty.
Alrighty, let's check your blood pressure.
Our residency program is really what makes AF Williams unique. AF Williams is the continuity clinic home for 18 of our university track residents throughout their 3 years of training. Our clinic was the second patient-centered medical home to be certified in the country. And as part of that, we have a really robust practice transformation curriculum that's evolved over the years and continues to evolve. But we see AF Williams as an important melting pot for interdisciplinary care and really robust residency education, in particular in practice transformation. At AF Williams, we have about 18,000 active patients and provide 45,000 visits a year. Of those visits, about 15% are Medicaid patients, 20% are Medicare, and the rest are privately insured. We are situated in an urban environment, so we're near Central Park neighborhood, Park Hill neighborhood. We're not far from Aurora, and we also serve patients coming from Commerce City and Montbello. So we have a very diverse patient population, and we feel well situated in urban Denver.
Sure. We want this guy.
Yeah, we want it.
Sorry.
It's still on my wrist slide.
Okay.
Sorry, y'all. Lots of different. We wouldn't be hosting anything here if we weren't having AV issues, right?
Kathy, you left us. Don't come back and break our computer.
Hey, listen, it was broken when I got here. Yeah, I didn't go very far. I'm still here.
Nice. I know, next time the road show comes, can we please get new flooring and paint the whole clinic? I'm right here. Please. I need you artwork in green pad. It's really boring.
So my first day here was one of Aunt Williams' first days here. I started like days after this clinic opened. It used to be bright and shiny.
It was the bright and shiny star.
That like, look at us like, wow, that is such a special clinic.
Yeah, it's special. Yeah, that's right. Yeah, now I like have serious floor tile jealousy when I go to put.
Okay. Great, yeah. Thank you.
No, they're so cool.
Ready? Here we go.
So this, we had a leadership retreat a couple of months ago and we wound up the day playing putt-putt. I'm not sure who won. It's not really matter, but probably Hillary.
I think it was
Um,
Emily.
That's par, get it? Anyway, some of the faces have changed. Megan Doan is no longer our nursing administrator, but we've got some really great candidates that we're interviewing now, and I'm excited for that. Kathy is transitioned out of our department, but hasn't gone far, just across the hall to work with Dr. Lyons in the residency department. And now we have Stormy, and we're very excited, and we welcome Stormy to our clinic to take over as our practice facilitator. And so I think the next slide is when David starts talking about the nuts and bolts. Is that right?
That's right. If we
This
can
is
get those
Wyatt,
two
the
bits,
practice
there we go.
Administrator, and he's gonna give you more detail.
Hi, everyone. I'm David Byad, Practice Administrator for the AF Williams Family Medicine Practice. This slide just goes over what we're composed of. So right now we have 27 exam rooms, 2 procedure rooms, 2 behavioral health consultation rooms, 1 ultrasound room, and 1 X-ray room. We are geographically located northwest of the Anschutz campus, so just about 15 minutes in car. As you see, the majority of our patients do come from Central Park, but we also treat patients from Park Hill, Northeast Aurora, Green Valley Ranch, Montclair / Colfax, Montbello, Northwest Aurora, and Commerce City. Next, so this is difficult to view. We're not asking that you actually read what this says. But this is just the demographics of the patients that we serve. So specifically, we have around 1,600 peds patients since the start of last fiscal year, as well as around 3,400 Hispanic patients. On these 2 images specifically are just displaying the high number of variability that we have within our patients based on their race and on the languages spoken. So we ultimately treat a lot of different patients in our area. Dr. Lyons went over most of this, so I'm not going to spend too much time on this slide itself, but this is basically the team members that make up our team here at AF Williams. Moving on to the next slide. First up, we have our excellent nurse team. We have 5 nurses that are all pictured here, as well as our charge nurse, Sarah Huntington. Right now, we do have a vacancy for our nursing supervisor role, but we're hoping to make an offer as soon as this Friday, hopefully.
Very cool.
Next up, we have our amazing MAs. So specifically, as mentioned in the video, we have 25 MAs, 2 of which are our lead MAs. Congratulations to Christina, who just recently became.
Yay, Christina.
I'll say that all of these team members are integral and essential to our job function and our ability to thrive as a clinic. So yes, definitely clap for them. Next, we move on to our administrative superheroes. So first, on the slide is our 5 patient access specialists, so that's the PASS team. We also have one supervisor, Caitlin, who's sitting right there. And then we move on to our stellar rad score, pictured here. They both provide radiology support as well as additional administrative functions supporting all of our patients and needs. And then finally, we're moving on to our integrated care team. These essential team members help to ensure our patients are taken care of and that our teams are supported. We can't do what we do without them, so they are critical to our team functions. So next, we're going to move into 2 different priority areas. So the first priority area is on providing recognition and engagement. We list them all, but I'm just going to call out a few important ones. So first, I want to call out our engagement console, who helps build engagement and morale within our team, specifically with such offerings as our staff and provider of the month, as well as monthly events that we host. Next, I also want to bring up our annual awards. That is actually coming up for next Wednesday. Voting is currently open, so I'm going to use this time to plug that. Please make sure that if you haven't already voted, that you go into the link that I sent, and then you do submit your votes. I had 25 respondents as of yesterday, and so there's still room for many more to respond, so please do. And then finally, we'll move on to our annual clinic retreat. So we can go on to the next slide. So every year we close our clinic for one session to go offsite and participate in team building and engagement. Special thanks to Kathy for having set these up for us historically. FY25 retreat will be a challenge without her, but we're willing to still try, and just know that this is an important event that we've been hosting. Historically, it was run in the summer, but we shifted last year specifically to the winter, to the fall, October. And it was successful both years in a row. So we're going to probably continue doing that.
It's much cooler than sweating like crazy in July.
Their building is a little toasty.
Yeah.
So moving on to the next slide. So this is the priority area of innovation and efficiency. So I'm just going to actually read through this slide. So things that we're working on for innovation and efficiency include development of our 50/50 APT role, same-day access, pediatric growth, controlled substance guidelines, that's an ongoing project for us, in-basket coverage guidelines, share drive / paperless workflow, that's for faxes and all incoming paperwork, RN OB visits, anti-coag visits, ED care coordinator role and duties, our DME coordinator, and our annual wellness visit templates. And with that, I'll hand back to Mimi.
So, what makes AF Williams unique? Well, it's the people, right? It's what the people do. And so, that's why, not everybody sits in gold pod, red pod, green pod every day to see patients, but it doesn't mean they're sitting at home twirling their thumb. Lots of things, lots of really amazing work is being done when they're not seeing patients, and it all directs around patient care. I'm not gonna read this, I can't see it really that well.
I had to make it very small because you're all doing such cool stuff. I couldn't make it all fit.
So I will just say, please go back and take a look at these slides when you have the time and your glasses on, and you can read to see what people are doing. But just a couple of shout outs, like things are going on locally in the clinic. But they're also being done around Denver proper, making sure the Nuggets can win another ring this year, and creating new residency programs, working on the national level, representing the Department of Family Medicine at the AAFP. Thank you, Corey, for all you do. And so this is what makes us shine, right? And so that's why we're here today. Yeah. Now, one of our shining bright people, and one of the coolest shining bright people I know is Heather.
Alex, making that work. Okay, I get to do all kinds of things that I really love, and I do them for the department and really focus on bringing them back here to AF Williams. So three of the big roles that I hold are working on clinical health equity with our clinical affairs team and the diversity and health equity team. I am on an interim basis leading the department's community engagement program, which is very fun and exciting and new for me. And then I've been teaching our residents their community health curriculum for over a decade. Oh my goodness. And this shows up at AF Williams in a bunch of different ways. So for the clinical health equity work, I lead our AF Williams Health Equity Action Team, AFW Heat. Where are my heaters out there? Thank you, thank you. And some of the really exciting things that we've done lately, we are focusing for now on our diabetes outcomes for our Hispanic and Latino population, because we see that we're not getting their blood sugar under control as well as we are for our other populations. So we hosted a listening session of patients and their families to hear what was their experience of care like and what can we do to make it better. And we learned some really valuable lessons that we're hoping to implement into actual clinical changes and how we deliver care to these folks at the practice. We also are working on encouraging our staff and providers who speak Spanish to take the language fluency test. And we have a couple study sessions coming up in January. So if you're interested, talk to Ali Costello because she's our brave leader for that. For the overlap with the residents and the residency, we've been working on building in an equity focus into their quality improvement projects. So this year we're working on diabetes and CGMs, continuous glucose monitors for those patients, and working on specifically, again, focusing on our Hispanic and Latino populations to make sure that everybody has the same opportunity to have great diabetes care. For the sort of the center of all of these three circles is really trying to figure out how do we get everyone trained and ready to think broadly about community health, population health, being ready to engage with communities and community partners, and how can we strengthen the relationship between our clinical spaces and the community organizations that serve the same folks so that we can all work together really nicely in the same sandbox. So that is what I do in a snippet, and I'm around. You can always talk to me about this stuff because I will talk it like this aloud.
Thanks, Heather. Next, we have Ali Costello.
All right, the cool part about what I'm talking about is that Heather covered half of it, so that's what because a lot of what we're doing from an innovation and quality standpoint at AF Williams has to do with equity. So it's really cool to have those two pieces coming together. So Heather talked a little bit about our AF Williams HEAT team. We're really focusing in right now on our Hispanic and Latino population. We've done interventions with getting increased pharmacy referrals for Hispanic Latino patients who have uncontrolled diabetes. We're trying to create a clinic-wide guide to how do we take best care of our diabetes patients here and what are all the resources that we have. And Heather talked about the language fluency test and our initiative to try and get people to be certified. So talk to me if you want to learn more. Heather also touched on the R3QI project, but this is something that we do annually for all of our third-year residents and projects in the past. Heather talked about the CGM project that we're doing this year for equitable CGM access. In the past, we've done specific colon cancer screening targeting underserved populations, and then improved our trans care processes here at AF Williams. We also have a lot of connection with our system-wide projects, specifically the quilt projects here, and this year focused on annual wellness visits and have created these new annual wellness visit templates that are wonderful APPs have been willing to staff, and so we're getting people in for the care that they need. And then lastly, what could you, how can providers do better with the data that they have and the patients that they see? Tried to create a culture of using data to drive clinical quality. And so we have a monthly Metrics Mania email where I send out information about specific quality metrics that we're focusing in on that quarter, particular to each provider, so that we're sharing the data across the board. People have the ability to go into their slicer dicer to learn a bit more, but I feel like knowledge is power and we can't do better unless we know where we need to do better. So great stuff going on with innovation. Thanks, Natalie. Next we have Corey Lyon.
All right, great. And I'm gonna talk very fast, but I wanted to throw out something that's unique about our clinic is we're one of the only clinics in all of UC Health that is not branded the UC Health way. And that's really through leadership at the department level and clinic level and implementation level, because we value that we're named after A.F. Williams, and we wanted to keep that UC Health audience. So that's just important little historical. I was involved in that name changing battle, so it's really important to call out. Okay, so residents, here's a few of our, so over half the patients seen in this clinic are seen by residents. And so they are a huge part of our clinic. And here is all of our residents. Half of these folks are a DH track, and then the other 20 are here. It takes a village to train a resident. And so this is my village of faculty that all have a role. Some have more, but there is everybody here touches a resident's life during their growth. So, and this is why we do the work. For some reason at graduation, they said, Corey, let's lift you up. And I said, I'm so excited. Okay, let's do it. I've consulted for you. So a couple of quick things about, so
I got a picture, I just never got that.
So 20 residents see their continuity patients here, and they are impaneled, and they're the continuity PCP provider for these patients. And this is a learning laboratory. Most residents will go out and do ambulatory, outpatient, broad scope family medicine. And so this is where they learn about team-based care. We believe our staff, the MAs, the front desk folks, they are part of the education of our residents to learn how to function in a high-performing team. Interprofessional training with our care managers, our social workers, our pharmacists, our psychologists, all of it is an important part of their education. The QI project you talk about, lots of procedure training, really trying to grow our ultrasound and POCUS training, more to come with that, and really that broad scope family medicine care. So then we also, a big part of our residency is the inpatient team. And so a lot of our faculty are attendings on that team, and then the residents work on there. So it's even though we're in a big academic center, we're able to kind of keep that true family medicine feel with our team, because we admit we're the only service out of 8 hospital services that admit their own patients from their clinic. So when our patients go to ER, they admitted by us, which then we are able to do their transition to care much better. And it's a combined adult mom baby. So our residents will go to the ER, admitted adult, and then go do postpartum rounds with mom and baby, and then go do a labor triage. And if they're lucky, they get to deliver a baby all in the same day. So all residents participate in OB newborn care. We care for about approximately 650 patients annually, and we have a 7% readmission rate. That is amazing quality care that our residents are providing. 150 OB deliveries. That number's been updated. We're averaging about 170 OB deliveries annually, and our C-section rate is the lowest of the groups at 10%.
Yeah.
And then last part I'm just talking about is OB training is a huge part of what we do. So it's required. We have amazing faculty that have made OB a core curricular component and have really mastered it. And then we get great support from the clinic with our nurses doing the OB intakes and helping us with the care of those patients with NSTs and glucose tests and everything involved. And we have an advanced maternity care concentration for residents who really want to make OB part of their future career, so they get that extra training. I think that's it.
Yep.
All right, thank you guys.
Now we've got Jeremy to talk us through our integrated behavioral health.
Hello, everyone. I am Jeremy Stevenson. I'm a psychologist and really privileged to get a call out some of our faculty and services that we provide. We have a big team. It's grown extensively. Where would I start? I'd probably start by calling out the faculty. The people that I work with are wonderful. I want to mention that we're not just doing clinical work back here. So Dr. Beckman, who was escaped because she knew I was going to call her out, maybe. She's also director of didactics. And so the A.F. Williams or the interns that you all work with here are not just at A.F. Williams. We have interns from JFK. We have interns from Reaching Hope. And I'm missing somewhere else. Not Cedar. Always missing one other spot. So she's responsible for all the didactics every Monday, and AF Williams is great. They let us use their space. We do that each morning here. I'm Jeremy. I do operations around here for BH. Joanna Stratton, she is actually our senior clinician. I don't know if you know that, but she's been here a very long time. I asked her if she could come today. She said she's got clinic and teaching over at Regis. She does supervision of supervision, which means she's training our current interns how to do supervision when they are finally licensed, which they're probably like that to be any day now. Chandra is the Director of Behavioral Health and Integrated Services at AF Williams. And so you may see, or across all of BH at all the clinics, which you may see here on Thursdays. All right, our trainees are really the lifeblood of our program. We have two types of trainees, actually three. We have interns, externs, and fellows. And for those of you who don't know, externs maybe have never done any counseling, let alone been exposed to a primary care medical center, which is arguably a little bit more complicated than day-to-day mental health care. Our interns are folks who have specialized in primary care and are coming here and getting this great training. And we don't have them up here, but we're also into our second year of a fellowship. So we have 3 fellows, and they actually leave AF usually as interns and then go into some of the other surrounding clinics. So you may see them, say hi to them for us. We miss them. Okay, next slide. Okay, some of our services. We provide basic behavioral health services. Well, lots of counseling on things from depression, anxiety, stress, trauma, lots of trauma, and plenty of ADHD. You like an ADHD evaluation. I remember from the Lone Tree Roadshow. You can just go down there. Crisis support. We do a ton of crisis support, often working with our beloved colleagues in nursing. Very happy to have them and happy to work in tandem with them. Also consultation, warm handoffs, inbox, Epic Secure chats. We are here for you, and support medicine, which we're very fortunate to go work with a great team. Evaluation, we do bariatric evaluations for patients that have physicians in our clinic, as well as we also are doing ADHD, like I mentioned, and we're writing letters, not necessarily an evaluation, but happy to be here and being part of the gender affirming care support that we provide here, which is really high quality and wonderful. I would be remiss if I didn't call out the telepsychiatry team. I wish Dr. Calderon could be here, kind of representing that team, but we have the wonderful Dr. Lynn Fenton and Dr. Leah Watson, who's kind of a newer addition, and we're getting ready to have a new psychiatrist. I didn't have that up whenever we did this, so I will just say, how many places can you go and get same week psychiatry service?
Very cool.
And in case somebody wants to check me on numbers, I actually looked. We have availability tomorrow.
Yes.
You need a psychiatrist tomorrow. I don't know where else you're going to go to find that kind of service. So
Thanks, Jeremy.
happy to be part of this team.
All right, now we've got Liza to talk about our integrated clinical pharmacy.
Thank you. My name is Liza. I'm a pharmacist. And I'm part of the clinical pharmacy team here at AF Williams, which is comprised of myself. I actually have a 50-50 split position. So when I'm not here, I'm at the School of Pharmacy teaching and doing other things. And the rest of clinic is covered 50% by Ben Hill, and then Joe Sissine floats in still about a half day a week. I'm also the residency program director for our amazing residents. We have 3 this year, Alexis, Natasha, and Elisa. They don't just train here at AF Williams, but we do extend their AF Williams rotation because we think it's a wonderful training environment. And we want them to get extension with our chronic disease state management. So they get 6 months here and they overlap with each other. So each one of them will cover 6 months in total at AF Williams. We also host our students from the University of Colorado School of Pharmacy. We take our 2nd years, our 3rd years, and also our 4th year students. So what do we do here? One of our big roles in this clinic is collaborative drug therapy management practice. And so we have CDTM protocols for things: hypertension, dyslipidemia, diabetes, and osteoporosis. Definitely diabetes and hypertension are the bulk of our referrals. And what we do is kind of bridge patients between their primary care provider visits to help with initiation and titration of medications for these chronic disease state managements that need more touches than a couple times a year. We're also piloting, we are in the process of billing for Medicaid patients, which is new. So we're actually getting a little bit of money for our services that we provide. Our other time is spent on consultation and drug information services. We get lots of questions from our wonderful providers. I do want to call out our achievements, and this is from a clinic as a whole, but every year the American Heart Association and the American Medical Association give certain status for different metrics. So we got gold plus level in our blood pressure control. We got gold level on our cholesterol control, and we also got gold level in our diabetes control. Yeah, this is not where
That's control, not just treatment, a diagnosis and treatment. But
it
that's the
is. So
control.
for the diabetes, it's
A1C less than 8.
less than 20% of our patients have an A1C greater than 9. That gets you gold status. So actually we were doing good. And this is definitely a joint effort with everybody here, but hopefully some of our CDTMs have helped impact these measures a little bit. Our team also does clinic-based research. So here's just a few projects that we've published based on work that we've done, either that included patients in our clinic or were specific to this clinic. You can see it's been on gout, it's been on contraception, statin utilization, ED utilization. And then also we just want to call out that there's been a lot of changes at the UC Health level in the pharmacy department, where funding has shifted, and primary care was not where they wanted to keep residents. So we went out and we found our own funding to keep our residents here for UCL and Medicaid. So that's why they're able to spend a lot of time in this clinic, because of our attrition rate of Medicaid patients.
Thanks, Liza. Nice. All right, now we're gonna hear from Morteza about sports medicine.
When I came here, we started at Leedsdale Clinic, and I think a few months later, then Linda started. So one thing about our clinic, Leedsdale, the first, I think first few weeks, I was hearing something going on in the roof, and I didn't know what it was. I found that those were rats. So
And squirrels. We also had the squirrel infestation.
state-of-the-art clinic, so I know just so much. So I'm just gonna be very brief. We do a lot of stuff, in terms of just education, in terms of teaching, in terms of scholarly and clinical care. I just want to make sure that the most important part we do as a sports medicine here is just take care of a patient. A lot of them, they are not get accepted by ortho and other departments because they don't have insurance. And so I think we just take care of a lot of the stuff we can do it in this clinic. We just take care of them. But what we do here is not possible without help of the entire clinic. From everybody, just from leadership. From I think all of the people here just helping us. Just a lot of we do ultrasound diagnostic and also the procedural part. Can you go next, please?
Morteza, can you stand over here?
Yeah.
They're having a hard time hearing you online.
Sorry.
Thank you.
Sorry. So I think it was 2010. I just was approached by our public schools. They didn't have anybody to cover their games. They have nothing. So I think at that time I started having some relationship with them. And then Jack Spindler came just a couple of years later. He took over and he just basically take care of them. So our public schools there, they don't have a lot of them. They don't have anybody to do any physicals for them. They don't have anybody to cover the games. So I think our residents, I can see that here, including I think, Corey and other faculty, and these are our residents. We just do physicals at the beginning of the year. Very, very cheap for them, I think, and then just provide a lot of care for them, and also covering a lot of them. Majority of the residents are involved with our public schools. Just want to make sure we just aware of that. So the fun part, yes, we covered like some pro sports. It's just very fun. It could be very cold. Next, please. And yes, I think is a fun part, just taking care of the Denver Nuggets. But let me just be very clear. Taking care of Denver Nuggets, is impossible without help. I have a VIP patient, somebody needs something, they text me. I'm on call 24/7, by the way. And then they get a call, I need this. And a lot of people, other clinics, they don't understand it. This person cannot just wait for 2 weeks to see somebody. So I think, I get help from a lot of people here. From David to I think Sarah, and they just, schedule the patient, and it just sometimes I'm not here. They just take care of the patient. They just need this and this. Just want to make sure everybody here in the clinic is just, responsible, including, I think, a special thanks, I think, to the radiology tech, and also Sarah, which basically, I basically abuse her. And, thank you so much. Yeah.
Thanks, Morteza. Okay, we have Alex.
And I wanted to bring, because this is a clinic of champions.
Oh,
the ring, and if you want the rings that both Morteza and Jack and I have
wow.
received. So, yeah. So, yeah, no, it can't break.
Still
So,
roll away.
with that, you can pass it around.
Wow.
But
Oh my
I'm
gosh.
keeping an eye out. I'm keeping an eye out if anyone, yeah, you can take it, yeah, do whatever. But I'm keeping an eye out in case someone walks off with it. Kyle, I know where you live. Right near me, so that like, so.
That makes it easy. Just
bring-
take it
bring
home
back
for me.
there. Yeah. So, yeah, so with that, I wanted to talk a little bit about some of the community work that's happening here at AF Williams. And so one of the things that, and some of you may have seen this, is we've been doing this program called Project Hair Care. And Project Hair Care is a collaboration with the Colorado Black Health Collaborative, and then the Department of Family Medicine, and really our clinic. And our clinic has become a home base for training barbers and stylists in the Black community here in Denver in mental health. So they are therapists. They really are. They hear the same stories that our behavioral health team, that all of our providers and MAs, I mean, everyone hears here. They hear it in the chair, and they don't necessarily, they have some tools, but they don't have a lot of tools as well. And so I think you can go on to the next slide. So with that, so this is actually our team. And so these are, so we received grant funding through a number of different methods over the past few years to build relationships, and then to really to bring people in from the community. So these top folks, so these are operators. So both Michael and Rosalind, they have shops, so it's salons and barber shops on Colfax. So just right down from here. And then, and just back.
Oh, I'm sorry.
That's okay. And then this is just our team, but Dr. Terry, so she's an internal medicine doc that now retired, but now runs, is part of the Colorado Black Health Collaborative. Dr. Ivy is another psychologist that I work with. Alfreda is a nurse who actually really helped to start this program of providing health in barbershops. So they do screenings, they do blood pressure screenings, diabetic foot checks. And so we're looking at ways of bringing the residency into that as well. So you can go on to the next slide. But this is what our goals were. So we wanted to, bring in operators who were interested, and they actually, we met with them. They said, we wanted to learn about mental health. We don't know what to do. We're overwhelmed. And so with this, we've taught them different tools, different skills for our residents. We're teaching them the bathe technique. So like that's what they're now using in the chair, breathing techniques, but also giving them handouts as well as ways that they can get connected with providers that look like them in the community. But the other thing that's really been a big deal is that it's created a support group. So all of these operators, and they've been doing this anywhere from 6 to 40 years. They now view this space and AF Williams as a place where where they feel comfortable, where they're able to share amongst themselves the challenges that they experience. And so they look forward to coming here. And so these are the topics that we go through as well, because this is all the stuff that they're seeing as well in the chair. You can just go on to the next slide. And so, one of the cool things is it's just, just like we train residents here, to then go serve many. We're also training now, training mental health professionals. We're now training barbers and stylists, and they are taking this out in the community. And we did some qualitative research, and this is what they're saying, in terms of like, first, you can see on the quantitative what they're talking to their clients about, same stuff that our family docs are talking about. And then they're using some of the same skills that our family docs know about as well. So it's been really, really fun and exciting. So thank you.
Nice. Thanks,
Okay.
Alex. Okay, last up we have Naomi to talk more about our OB care.
Yeah, so I'm Naomi Malum, and just briefly about our OB care, Corey touched on this a little bit, but these are all of our faculty OB providers here at AF Williams. All of them work in the inpatient service too, and 2 of them are C-section providers as well. We do a lot of OB care here, a call out to the residents who provide the vast majority of the prenatal care. And our nurses who really drive a lot of our kind of QI projects around OB care too. We can do ultrasounds and NST here. We can keep a lot of our high-risk patients in-house and either manage independently or with our MFM assistants. And all of that is done really with the support of the whole clinic. And then these patients are delivered on our residency service. So continuity with their care team throughout their pregnancy and at the time of their birth. And so we have lots of things that we're working on to, expand our volume, but we are really proud of the work that we are doing right now. That's all I got.
Thank you. Let's see, to take it on home.
Can I say one thing? I didn't see a thing for UMA or other learner teaching, and I just want to call out all of you. It's like the secret thing that we all do that nobody ever thinks about even put in a slideshow. So we have part of our LIC, we're one of the major LICs. We have 10 learners over 10 months. We also have Carol takes learners, our site team takes learners, our farm teams takes learners. We also have fourth year folks, and we also on of FMIS who have active internships. This is a huge part of what every person in this room does. So thank you for teaching our pre-GME learners as well.
All right, so leadership team vision for 2024, next slide. When we had that leadership retreat, I used all the slide on way back when. This is sort of what we came up with, and it's granular. We do need to improve our printing capability. That is the goal for the future, but it also mushroomed out to saying that I think the Department of Family Medicine as a whole is committed to. And so I'm not going to go into these specific things, but I think our goal as a whole is to provide great patient care, but it kind of, we want to do it in a manner that supports the folks who work here, and to make it, reduce in-basket burden. I think if I would ask anyone in here, what do you want help with, that would be it. And so it's an ongoing process, and it's really nice that we get the support from the folks ahead of us that have gone on. Dr. English does a great job, just tells me every day like what I'm supposed to do, and I don't know what I'm supposed to do yet. But anyway, this is sort of what we came up with. If you have any questions, Dr. Lines comes back in about 4 minutes. Yeah, and I want to thank everybody for coming. Thank the department for giving us the opportunity to brag on ourselves and showcase what we're doing. I learned a lot. I hope you all did too. And thanks.